pleasure to be president of the League of Women Voters of the Lewisburg area this year. It's not working?
Yeah,
it's working, but you can't hear me. Is that better? I'll hold it close. Okay. So I'm just introducing myself, saying it's been a pleasure to be president this year. We've had so many things going on, and I just have a couple of announcements, and then I'm going to introduce our speaker. The first announcement is on your table there is a card for our holiday member social. If you have not sent in an RSVP, we all receive something on our email addresses, unless you don't have an email address, but everyone got an e-invite is the term. It sort of slipped by some folks' attention. It went out pretty early, but what you can do is see Marilyn Murphy, who is there in fact, armed up. Marilyn has a sign-up list. We would love to have you come. Bring a guest. There's more information coming up in the next league line. So I think that that's the announcement from the membership committee. Did I miss anything, Ruth? Anything more? Okay. All right. The next league line will be coming out soon, thanks to Betsy Noyce, who's sitting in the back, and a team of other people. There, her arm's going up. Becky has an announcement.
You. Hopefully your curiosity has been piqued by all the interesting, mysterious things around the room. After this afternoon's luncheon, after we hear from Kendra and have a chance to ask questions, and the forum officially ends, we have the opportunity to spend an hour together looking at the work done to date on the strategy. And I'm very excited that today we will unveil the draft vision. And so this is very important. It's a great opportunity for you to hear and see what we're thinking about and provide feedback. So hopefully we'll be able to stay after the forum for another bit of time together around our future.
Okay, thanks, Becky. I will remind everyone again at the end, I hope to see as many of you stay as can possibly give us a little bit more of your time and thoughts. All right, I am going to introduce our speaker, who is Kendra Auker. She is president and CEO of Evangelical Community Hospital. And Kendra was appointed to that position just a couple of years ago, 2015. But many of us have known her because she's been in a leadership position at Evan since 1990. And she's worked in a variety of different parts of the practice and the business. And I think one of the most interesting things, because this is what scares me so much and I get so confused by it, frankly, is Kendra is a licensed agent through the insurance department for the Pennsylvania Department of Insurance. Medical insurance is you know, the thing that most of us shake our head at when it's time for enrollment, and you got to make some decision. You know, it's pretty crazy. But having Kendra's experience in that has been very important to the hospital and the success of the hospital. And another thing that I learned by getting a copy of her bio from her assistant, Allison, is she actually has an MBA from Frederick Taylor University, but she's a Penn State alum. So a lot of folks in this room certainly have those affiliations. My own experience in hearing Kendra as a speaker is a few years ago, one of the many awards that she has received for her outstanding leadership to our community is she was a recipient of the Adam Smith Distinguished Leadership Award through Economics Pennsylvania. And she gave just an excellent talk, and it really made me think about things in a different way. So I am looking forward to hearing from Kendra today about the topic. I'll do the big reveal: community collaboration and connections, fueling growth at Evangelical. So thank you very much, Kendra.
Thank you very much. So when Linda Korb came to me and asked me to talk with you today, you know, I said, what should I talk about? And she gave me some suggestions, and I've incorporated some of that into my remarks today. But it really forced me to step back, as was pointed out here by Terry. I stepped into this role, it's about 4.5 years ago, and there's been a lot happening at the hospital during those 4.5 years. So I thought I'd tell you a little bit about what we're doing, why we're doing it, how we're going about doing it, in what is, you know, arguably a crazy time. I could say just in healthcare, I would say it's a crazy time in everything right now in our world, but healthcare is a little bit crazy. So when I stepped into this job, This is, let me make sure this is on here. No. This is a map, and I don't expect you to see the details of it, but this is what was happening around us. Healthcare was consolidating. Everybody was becoming part of a few systems across the state. So in the yellow is the Geisinger system. In the blue is there, and in the salmon colors are the Highmark system and the UPMC systems. And UPMC came into our north by acquiring the Susquehanna Health System, and they're very active now to our south. You also have St. Luke's to the east, and the Lehigh Valley systems, again to the south. You have some other systems in Wellspan. The bottom line is healthcare is consolidating. And just as a point of interest, there are 156 hospitals in Pennsylvania, and as of yesterday, there are 25 independent hospitals. So we are one of only 25 independent hospitals in the state, and you know, I think the number will continue to change. I think the 25 that are standing are trying to figure life out a little bit, much like Evangelical. So really, why is the market consolidating? There's shrinking operating margins. It's harder and harder to make a margin in healthcare. There's much conversation about rising costs and what's happening, but it's very hard to make a profit. And you have to make a profit in order to continue to invest in your technology, your facilities, your equipment. So that's all capital. And so there's limited access to capital dollars to continue to improve your services and facilities. The cost of IT is huge, and it is an important part of the healthcare delivery system, but it is very expensive to have a robust IT system. There's a need to reduce the cost of care. This is the conversation in healthcare. How are we going to drive down the cost of care? And there's a number, and this is again at the time, and there's an increase in un- and underinsured. And some of that was addressed through the ACA, but the reality is we went from a number of uninsured people to a number of underinsured people, in the sense that people had high deductible plans. And in central Pennsylvania, if you have a $10,000 deductible to meet before you get 100% coverage, you don't have $10,000 in the bank. And hospitals have to treat everyone regardless of their ability to pay. So we were feeling and are feeling the pressures of increased charity care and bad debt. And like I said, there's higher out-of-pocket expenses. The cost of healthcare, employers are pushing the out-of-pocket up in the plans to their employers to make those plans affordable for them. And payers are moving from volume to value. So whether it's Geisinger Health Plan, whether it's Highmark, Capital Blue Cross, all of their plans are designed around moving away from the old fee-for-service model of healthcare, where you did, 2,000 MRIs and you got paid for 2,000 MRIs, to value, where they're looking at getting you into other services first before they pay for that expensive item, where they're designing, they're driving you to urgent cares and keeping you out of the more expensive emergency departments. So there's a lot of changes in how healthcare is delivered. And the bottom line with all of these pressures, we need more access to patients. So as an independent hospital, I would tell you that we were lacking in two really important areas. This hospital has been supported hugely by this community, and we do have money in the bank. But where we were lacking, when you look at why market consolidation was happening and why hospitals were joining other systems, was because we didn't have a payer strategy. EVAN is too small to own its own insurance product. And what was happening is you're getting managed, so to speak, out of the market. So all of the health systems have their own health plan or an alignment with another health plan, and you were becoming